First of all, thank you everyone for joining us this afternoon for this webinar titled Cycling to Cut Carbon and Boost Communities. I'm Matthew Burke, a researcher at Newcastle University here, working on the DARE Hub. So who we are, we're the National Hub for Decarbonised, Adaptable and Resilient Transport Infrastructures. Our aim is to bring together the UK stakeholders from industry, government and civic partners, and we're trying to find viable pathways and solutions for a transition to a resilient net zero transport system. We're funded by the EPSRC and the Department for Transport. So our theme today is cycling to cut carbon and boost communities. So how can we, as a very decarbonised transport method, increase cycling adoption in the UK? And on top of this, we can enhance public health and well-being at the same time. We've got two excellent presentations today. Our first from Jonah of Sustrans, recently adopted partner at the DARE Hub, and Professor James Woodcock from the University of Cambridge, who will be speaking to us about his propensity to cycle tool. So over to you, Jonah. I'll let you start.
Thanks, Matt. Right, share my screen. Okay, I'm hoping you can see that in the right window.
Yep, that's perfect.
Okay. So yeah, hello everyone. As Matt said, I'm Jonah Morris. I'm the Partnerships Manager for North Eastern Cumbria at Sustrans, and I'm going to be running through a presentation on some research that Sustrans have carried out recently, mainly focusing on the walking and cycling index, but also some other bits of research that we've recently published. So this webinar is titled Cycling to Cut Carbon and Boost Communities. I'm going to broaden this out straight away. So the Walking and Cycling Index is the UK's biggest assessment of walking, wheeling and cycling, and we cover all three of those, walking, wheeling and cycling, very deliberately to cover those that those that walk and those that use any kind of mobility aid to move themselves around. So the 2023 report of the Walking and Cycling Index, which was published earlier this year using 2023 data, covered 8 Scottish cities and towns, 8 English urban areas, Belfast and Cardiff, and for the first time 5 areas within the Irish Republic. So the areas in the Irish Republic are funded by the National Transport Authority, so they're equivalent of the DFT. In Scotland by Transport Scotland, and in England by the Freshfield Foundation and the areas themselves. I have a northern focus within Sustrans, so within the north, we already have coverage across Greater Manchester Combined Authority and Liverpool City region, and the Tyneside footprint, you can see the dot on the slide, is now going to broaden out to represent the North East Combined Authority footprint. So we're trying to cover combined authorities wherever possible. Tower Hamlets that you can see on screen have unfortunately left the programme this year due to funding constraints, but have been replaced by Leicester joining the programme. So the index has 3 main audiences, so transport planners and those working directly within active travel and transport, city and regional leaders, where the index can be used to make the case for investment, and also the business community, where the index can be used to drive investment decisions. I'm responsible for the Newcastle or Northeast edition of the index. It was previously called Bike Life. It's been in existence since 2015 and is based on the Copenhagen bicycle account. In 2015 and 17, it was published in the Northeast in partnership with Newcastle, and it mainly focused on those cities that have been the recipients of Cycle City Ambition Grant funding. In 2019, 2021 and 2023, the index expanded in the Northeast to cover the 3 authorities of Newcastle, Gateshead and North Tyneside. And it's now moved to the Northeast Combined Authority footprint. And this does bring some challenges. It's used to be an urban focus report, but obviously within the Northeast, we've got a large amount of rural, peri-rural geography. But the Combined Authority using it as a baseline for funding coming down the line through funds like CRSTS to baseline that investment. So the index is there to provide a solid evidence-based to secure investment and deliver change. We have a wealth of experience in using the index to drive investment, whether this be at a national, regional, or local level. It allows authorities to measure the attitudes and behaviour of the population through an independent representative survey, helping to understand residents and their views on walking, cycling and wheeling and its interconnected policy drivers. So the index covers a wealth of behavioural data from the representative survey, which is carried out by an independent survey provider. 1,100 residents in each area are surveyed, and this is a representative survey of the general population, so not a self-selecting group of cyclists. The survey also provides attitudinal data around key policy areas. In the example on screen, this includes physically separated cycle paths, 20-minute neighbourhoods, low traffic neighbourhoods, increasing space in high streets, pavement parking, and investment moving from road building into walking, wheeling, cycling and public transport. The index also relies on data provided by partner authorities. So through GIS data supplied, we model a range of different scenarios. In the example on screen, this is centered around infrastructure provision. We also produce modelling using tools such as Sport England's Move tool and WHO's Heat tool to show savings to the NHS, as well as economic benefit and the savings in greenhouse gas emissions. The information on screen is taken from the national aggregated reports. So I mentioned there's 1,100 residents within each survey area. When we have that across a UK and Ireland level, we're talking about over 23,000 recipients of attitudinal data, which gives us a large data set to work with. We also perform interviews with case studies, whether these be members of the public or people involved in active travel. So we've had directors of public health, bike shop or business owners in the past. The human element is important in the influencing work done around the index and is often a hook for media engagement. So as I mentioned, all reports are collated into the UK index report showing the combined surveys covering all areas. So if your area is not necessarily covered by a report, the UK aggregate report is a really useful piece of research. So some key messages coming from this report at a UK level. It's used to show why investment is needed on a national scale and where key target demographics are in attitudes and behaviours towards walking, cycling and wheeling. We've also produced an index data tool, which is available on the Sustrans website. We have 5 dashboards associated with this, so covering what people think, so exploring attitudes to walking, wheeling and cycling. For example, you can find out what people think would make them cycle more, what they think of their local area and where they would like to see government spending. One covers what people do, so exploring people's walking and cycling and wheeling behaviours. For example, you can find out how frequently people use different types of transport, what they cycle and walk for, and how many short journeys they make by car. There's also city data. So in this dashboard, you can find a range of measures on the environment for walking, wheeling and cycling. So for example, you can find the percentage of households within walking distance of food shops, total length of different types of cycle route, or the percentage of total street length covered by 20 mile an hour limits. There's also trips data. So this dashboard allows you to see estimates of the total amounts of walking and cycling being done to destinations and for leisure or fitness. So for example, you can find estimated numbers of walking and cycling trips made yearly and comparisons between areas relative to the size of their population. And finally, we've got benefits data. So in this dashboard, you can see measures of the economic, health and environmental benefits of walking, wheeling and cycling. For example, you can see estimates of the long-term health conditions avoided, greenhouse gas emissions averted through walking or cycling instead of driving. There are comparisons between areas relative to population size. So we use the index as a key influencing tool. As I mentioned before, this can be at national, regional or local level. and gives powerful statistics and demonstrations of why further investment is needed in walking, wheeling and cycling, both in terms of infrastructure investment and behaviour change interventions. It's important that this isn't just focused on transport investment, but covers public health as well as regeneration and placemaking. So the report's published every 2 years. In the fallow years before report launches, we often run bespoke reports based on data gleaned from the index. We've previously published reports around the revitalisation of high streets, a report addressing women's safety, and the data from the index formed a large amount of the research into the Disabled Citizens Inquiry, which was into disabled people's representation in transport decision making. In spring next year, we'll be releasing a bespoke children's index using a new survey of children aged 6 to 15, but linked with index data. So I've just mentioned the Disabled Citizens Inquiry, but we use the index as an anchor to a whole range of further research. This includes research recently published around cycle access for those on low income and not in employment, a cycle to work scheme for those not in work, and research around cycle storage. So to highlight one of these reports, the Cycling Opportunity looks at the cycle to work scheme for those currently excluded, those on low income or unemployed. This research was funded by the Aberdeen Financial Fairness Trust. So the scheme uses a number of differing propositions for central or local government to look at a £50, £100, £150 or £200 discount, or a percentage discount of 20, 30, 40 or 50% discount level. The workbook behind this is available for you to use and is available on our website. So as an example, for the North East working age population of 1.2 million, the cost of the scheme would be £535,000 with a BCR of 3.3 to 1. This would lead to an additional 797,000 cycle trips per year, averting 108 tonnes of greenhouse gases and removing 116,000 car trips from the roads per year. So it has immeasurable benefits beyond those that use the scheme. So on screen are some of the costs of a voucher scheme implemented at a UK government level. So this is on the assumption of 100,000 people taking up the scheme per year, and based on a cost of £18 million to UK government. But this brings £20 million savings to the NHS and £60 million in a year in benefits to society. So the report was launched at Westminster with the Minister for Active Travel speaking at the event. The report is now being considered by government. And just to touch on the other report that I mentioned, released at the same time, looked at cycle parking at home for those on the low income. So this is often in flats or terraced housing. This answers the other side of the coin from the previous reports of once people have access to a cycle, where can they store it? So this found that 3.7 million people do not have a secure and convenient space to park their bike. So the 47% on screen equates to 5.5 million people who could start to cycle or cycle more. So the report came up with three main recommendations. So the first being local authorities should increase residential parking provision, prioritising flats and areas of deprivation. This includes providing communal cycle parking for flats and in areas of deprivation. The second covered governments across the UK should put in place standards, investment and regulations to improve residential cycle parking. So this includes amending permitted development rights for householders to allow the installation of cycle stalls at the front or principal elevation of houses and flats. Moved on. The third recommendation was that governments across the UK and local authorities should work together to tackle other barriers to cycling for people on the low income or not in employment. And this includes a recommendation that governments across the UK should provide financial support to people on a low income or not in employment to buy a cycle. So just to conclude, we, as an organisation, we carry out a vast amount of research, almost all of it public facing. It's all available on our website, and we use things like the Walking and Cycling Index as a central pillar of that research, which other research then is hung off. And that's my presentation done.
Thank you very much for that, Jonah. Really interesting. I've got a few questions myself, but I can see there's one popped up in the chat already. So is there any study comparing on-road cycle path and well-planned separate cycle paths? Does the amount of active travel uptake, is it related to how the availability of safe infrastructure in the first place?
Yes. So the Walking and Cycling Index, the GIS data that we get from city partners includes the percentage of, or the distance of cycle provision by type. So we know that safety and perceived safety is the main barrier for people taking up cycling.
Yeah.
And if you think of the target demographic that we're really trying to achieve change with, are those that are on the cusp of making that transport change, then yeah, safe and secure cycle infrastructure is absolutely key to that. So I don't have any. Oh, so for the Northeast, 58% of people supported more cycle paths along roads, so physically separated from traffic and pedestrians, and only 22% opposed a scheme of that sort. So we know that it gives a really robust evidence to transport planners, local authority, combined authority partners, that this is the voice of the population of which they serve. So yeah, it's well worth a read.
No, I agree with you, and that backs up virtually any academic study with regards to this. It's segregation is very important from a cycling perspective. That was good. Actually, led me on to a question I had. It was you were mentioning some of the pro attitudes towards separating cycling and even the low traffic. Was it hang on, was it 62% support? But then what we hear in the media is often this fierce opposition, and I mean, there's examples in Newcastle where they've struggled for this reason. Why do you think there's such a gap between what they're saying in the Sustrans studies and what we read about in the media that people's attitudes are towards these things?
So, I mean, the culture wars of the previous government really didn't help in terms of this. As you mentioned, 62% support the creation of more low traffic neighbourhoods. So we know from a resident's perspective, there's real benefit to these, and they see the benefit where they're implemented. I think a lot of it is to do with messaging, and a lot of it's to do with making sure that full engagement happens with the community before any schemes put in. But the headlines in the media are a small subsection of society. We know from this being a representative survey that 62% support this and only 16% oppose it. So we know that in reality, when it comes to asking people if it's going to make an effect on the place that they live, they can see the benefits of this.
Absolutely. I can see Ali Ford has asked there, are there any examples of local authorities who are doing particularly well on providing residential cycle parking, especially in areas of terraced housing and flats?
Yes, so we haven't got many examples within the Northeast region, but in Scotland, London and Greater Manchester, cycle hoop style parking has huge waiting lists. So we know that the demand is there. It is a particular issue within flats and terraced housing. It's finding the place where it can It can go, but it can also answer the previous question in terms of kind of low traffic neighborhood. You could block the end of a street with cycle storage, you know, solving two problems in one, creating that kind of low trafficked neighborhood and providing cycle storage at the same time.
That sounds good to me. Another question I had, because I think we've got a bit of time. There were some key demographics you could select with the index. Have you compared somewhere like, taking a Dare Hub partner, Cambridge, with say Newcastle? Has there been anything? Is there any obvious trends that are causing the differences in cycle uptake? It's not an easy. Obviously, there's geographical issues and everything, but has anything really stuck out there when you've looked nationally?
It's not something that I know an immediate answer to, but the index data tool that is on our website allows you to select different areas and compare and contrast between them. So in the example you gave, Greater Cambridge is a partner in the study, so we've got data from them. It helps where we've had authorities that have remained consistent on a geographic level from year to year. The whole idea of a 2-year study is, like I said, based on the Copenhagen bike count, where they're looking to see the incremental improvement over years. But the data tool's a really powerful piece of research that's publicly available on our website and allows you to compare all of the different behavior, attitudes, city data between different partners. So yeah, it's certainly something that I don't know the exact answer to, but yeah, anyone on this call could go and give it a try or contact us and we can look into it.
Yeah, yeah, fantastic, Jonah. I definitely think they should. Shall we move on to James now for that? So thank you very much again, Jonah, for your presentation, and we'll move on to James's presentation.
Thank you. Is that working okay?
Yep.
I see it here. Okay.
Yeah, all good.
So I'm going to talk about the propensity to cycle tool and then a little bit about some subsequent work that we're doing, and then the discussion perhaps could talk about how that leads on to Dare. Sorry, I've got a bit of a cold today. So propensity to cycle tool, we created this to deal with a planning problem. The question about where to build cycling infrastructure, and often it's where it is easy to build. What happens is where it's easy to build, where there are a lot of current cyclists. But what about where there are lots of potential cyclists? How do you estimate this cycling potential? This is the problem that we're trying to tackle. And with the PCT, we developed an approach for estimating cycling potential. It focuses on the census 2011 origin destination data, travel to work by mode and by sex for both the middle and the lower super output areas, with distance and hilliness from cycle streets. And we model current cycling propensity as a function of distance and hilliness. So chances that someone will take a trip by bike based on the trip distance and the route gradient. And both of these are very strong determinants of behavior. And then we model cycling uptake, health and carbon impacts under 4 scenarios. Government target, there's now 2 versions of this, gender equity, and then the 2 most ambitious scenarios around Go Dutch and e-bikes. Go Dutch being kind of the cycling propensity in the Netherlands, and e-bikes being that, but cycling propensity in the Netherlands along with e-bikes as well. Yep. The PCT can be thought of as either a kind of model and data sets, or also as a user interface, the website. And from the website, you have a lot of potential to interact with the website and to look at stuff, or as I'll show in a minute, or to download data and analyze it yourselves. What we added in the most recent kind of upgrade was, well, a few things, moving to a full micro simulation approach, but also this near market government scenario. And because it's now fully micro simulation, it's able to account for the likelihood of different individuals with different characteristics taking up cycling. So it kind of, the near market biases it by age, gender, and ethnicity in terms of who cycles. And so you can look at it, the two scenarios, one based on assuming everyone is kind of equally likely to take up cycling based on their trip characteristics, and the other assuming that the current inequalities are replicated. And I think there's reasons why you might be interested in both those approaches. So there's three basic ways, as I say, to use, or three ways to use it: the interface, using the data downloads, or reproducing and modifying the code base. I'm not going to talk about the last of these today. I'm just going to briefly introduce the first two. So the interface, yeah, it's freely available online. Nothing needed to access it. You see here a map and you can covering up England and Wales. And you can look at some things basically at these regional levels. But to look more, you need to click on a region and go in. Here we're seeing for the Liverpool City region. You see on the right the different things you can choose in terms of the trip purpose, and we have just commuting and travel to school, the geographies, the scenario, and then how you look at the flows, as well as what base map you have. And at the top, you see some of the choices you have about the manuals, the videos, and the data for downloading. If you click on an area, I think here we're at an MSOA, you can see the number of commuters, you can see the number of cyclists at baseline, the number of drivers at baseline from that MSOA, from the census information. Then, if you run the Go Dutch scenario, you turn that on, you can see how the number of cyclists increases, very largely in this case, 2 to 24%, change the number of drivers. Because of course we don't just assume trips come from driving, we assume they come from whatever modes people were using before. The changes in the years of life lost, changes in sickness absence, changes in CO2, and for some of these we have a kind of monetary equivalent as well of these health outcomes. You can also look at the top lines. So these are flows, or between origin destinations, and here you're seeing where the top lines ordered by, as you can see, ordered by the number of cyclists. And you can see this obviously for baseline and 2011. You can see it for the different scenarios as well. And these are just represented at the moment here as straight lines, but there are options. You could also order the lines by, say, the biggest CO2 reduction. Of course, this looks different because the biggest cycling level will often be shorter trips. Maybe that often people might have walked or used public transport before. The biggest CO2 reductions will be where you've got more longer trips that have got more cars and more car distance from them. So you'll see a different pattern depending on your outcome. And so, yeah, by the number of cyclists, you see a different pattern by CO2. Zooming into an area here, you can see here with the again the cycling flows, putting this up to the 200, the most number of lines you can see for the cycling flows. The line-based information can give you, as I said, information on the number of, well, that's four, that was at the zone, now at the line, the flow between these two areas, the number of cyclists, the change in that, the change in drivers, and the change in these different health metrics. So you see the distance between the two these are the population weighted centroids of the MS or LSOA. You can also do the pop-ups to look at routes. And here we have two options of the fastest route, most direct, generally the most direct route, and also to look at the quieter route using the cycle streets algorithm. And we don't say which of these people would actually use, because often the PCT is saying, well, if you did put this infrastructure, then how many cyclists would there be? And so, often the assumption would be you need the infrastructure. With the infrastructure, the fastest route would become a quieter route because you'd have put the infrastructure there. But it's often, it's useful to look at both, particularly when there may not be big differences between them, or there may be, say, a parallel route that would be very suitable and doesn't add much distance to it. The second way, as I said, is about using the data downloads. And so, we strongly encourage people to do that who want to do more sophisticated analysis. And, we do see people sometimes using the PCT interface when they've got a problem that would be better to use the downloads. And I think the download, the interface is lovely, but of course there's quite a little limits on what you can do without it just getting far too complicated. And if you want to structure things your own way, your own analysis, and certainly then I would encourage you to use this. And we have run training on this in the past. And of course you can just do this. You can do this in R or whatever, but people often can just use Excel for the non-geographical data, or say QGIS, or for the geographical data. And the data downloads allow the ability to create bespoke visualizations showing areas like where the health benefits greater. You can look at different aggregations of uptake, like within districts rather than a region. And you can calculate benefits for tags for transport appraisal guidance, like along a main route where major infrastructure is planned. And you can combine with other data sets. You might want to look at childhood obesity levels or injury data or existing infrastructure. And we couldn't include all of these things within the PCT interface and have it, working as nicely as it does. So I'm not going to go. I'm not going to go through I haven't got time to go through the details of how you download the data, but it's all there on the website, and there's detailed manuals and training and other things available to support people who do want to use that. I was going to say a little bit on that, the health impacts and what we're doing in the PCT on that. The PCT estimates changes in physical activity from changes in cycling, e-bikes, and walking. It uses an improved version of the transport appraisal guidance for health and health economic impacts. And the transport appraisal guidance was, at least in part, originally based on the WHO heat tool for walking and cycling. But the heat tool itself has also developed over the last few years, and there's a new version out now. It calculates, unlike the heat tool, though, we modified it so it calculates. For the tag, that is, to calculate reductions in premature mortality, years of life gained, and for reduced sickness absence. So not just deaths, but years of life lost or years of life gained, depending on how you looked at it. I would say that in all cases, as I say, we do walking, just to be clear here. So when we run a scenario, trips switch to cycling, we will include that some of the trips are switched from walking, and we know what they are based on our baseline data. So if a trip switches from walking to cycling, there will actually be less physical activity. The trip will be faster, there'll be time savings, but there'll be less physical activity. And we can include that kind of loss in the health model as well. And so for some of the kind of short flows, if you actually do a lot more cycling, you might see actually less health benefits from health. But it's only fair that we calculate this in as well, recognizing that still, of course, there would be a time saving and benefit for the individual. E-bikes weren't originally covered in heat, though I think there is now to do that, but they have faster travel and require less energy from the rider than traditional bikes. So we adjust those both in the speed, the journey is less long, and also less energy expenditure. So the health benefit is smaller, but there's still a real health benefit. And of course, the key thing is that people are willing to do longer trips or longer distance trips. So more trips may be switched to cycling under an e-bike scenario. And we have new speeds, new physical activity intensity values, and give a smaller benefit for every minute spent using an e-bike than a conventional bike. We've also got hilliness included in a double way now. So our existing model, hilly areas tend to have lower cycling potential than less hilly areas. That was reflected in the core model, but our new approach also means now that we can represent that the physical activity expenditure is higher. So if you're going up a hill, it is more energy, as we all know, and therefore the health benefits will be greater. We've also got a sickness health absence in, trying to follow the tag kind of approach on this, but we have a bit of a more sophisticated health model behind it because we have a full micro simulation population now behind the PCT. So the economic value of reduced sickness absence using a similar approach to mortality. We use the tag values in terms of the 0.25, assuming that's equivalent to a value of physical activity energy expenditure, 8.75 marginal METs per week, which is around 2.5 hours of moderate to vigorous physical activity. And then we apply it to function sickness absence and total working hours, which vary by sex, age, and region, and we account for this. We account for this variability. You know, young people have less sickness absence than older people. Some regions and areas, people are sicker than others. We calculated this for each region in England and Wales. And then, you know, we calculate the reduction in sickness absence due to increased cycling and subtracted the sickness absence due to decreased walking. So we account for both these effects here, to be fair. And we account for average mean salaries in the economic, which obviously introduces a kind of bias, but it is trying to follow the tag approach. And also, particularly as we are talking about CO2, I mean, and one of the results, and this paper to go to look at is there's clearly co-benefits from cycling, health, potentially equity, greenhouse gas emissions, but the benefits, these things don't always exactly align. And we found that increasing, say, female cycling mode share is good for equity, but each additional female cyclist generated a smaller, on average, of course, health and carbon benefit than a male cyclist, because women have lower baseline mortality and shorter to commute distances than men and travel less by car. So, you know, the two things that if you wanted to just reduce the carbon, you might focus on men who do longer trips. If you wanted to focus on health, you might focus on men who also do, you know, kind of moderate trips and maybe a higher, you know, where there's higher health risks and so on. If you want to focus on equity, you might look at it differently. And I'm not saying these things are necessarily opposed, but we need to think they don't always work exactly the same. So the PCT is a sophisticated micro simulation model for estimating health and health economic impacts. The near market scenario uses individual and area characteristics to model cycling. Others just use distance and hilliness. Mortality reductions using individual age, gender, local authority mortality rates, because of course they vary between more and less deprived areas, and changes in active travel, walking, cycling, and e-bikes. We now include the hilliness in the physical activity calculation, and sickness absence is calculated similarly to health, but using different relative risks and average earnings. However, PCT, of course, is a limited approach. I mean, it's based, well, firstly, it's based only on the 2011 census. We know there's problems with the 2021 census and trying to use the data from that. And it'd be quite a major undertaking. It only does shift to cycling, though it's multimodal from the modes shifted. It's only commuting and travel to work because of the limits of the data we had. Only the mode of travel is assumed to change. We don't look at trip purpose and things. We don't destination changes, which just makes more sense for commuting, but is a limitation. And it looks at potential, not the actual effects of an intervention to say change the built environment. And the impact model is relatively simplistic, using mortality and morbidity in line with the kind of heat and the tag approach. So one of the things we've been doing, and just to introduce now, is work on the Jive and Glass projects that have now been taken forward as part of DARE, is integrated transport and health model for Manchester and Melbourne, in which we have a full behavioural model, and we incorporate the effects of the built environment on travel behaviours. With a full synthetic population and a full range of trip purposes. Here we have very detailed data on the built environment, on the traffic, on the green visibility, on the cycling and walking, well, particularly on the cycling infrastructure, and obviously on the hilliness and so on, but also on crime and other things before that may influence behaviour. And we producing a model that then uses these to say, well, what's the effect on people's behaviour at all stages, considering trip generation, the mode choice, the mode set that people consider, the destinations that they go to, the mode, of course, they choose, the scheduling of the trips, and the route on the trips that people take. And with a full behavioural model that can account for the complexities of going from home to work, going out for a lunch trip, going shopping, and then taking a leisure trip in the evening. And we increasingly work to add more of these determinants, built environment determinants, into more stages of the behavioural model as we develop it further. The advantage also of this approach is that using MatSim, the open source agent-based kind of network assignment for simulations, is we can simulate people's air pollution, noise exposure as they travel around the network, based on the different characteristics of the link and of the agent and how they're traveling and so on. And also, of course, how noise and air pollution are changed by changes in traffic. And we can calculate also injury risk, which we're still working on developing at the moment, and physical activity, of course, is accounting for the mode, for the gradient, and so on. This then we feed into a health model, and here we're now building a much more advanced health model, a fully longitudinal microsimulation model with diseases. Includes, will, when it's finished, include all the diseases and disabilities in relation to the physical activity and the different exposures. And because it's a longitudinal microsimulation, you can do changes in life expectancy, quality of life, years lived with disease, and so on. Yeah. And with this, previously work on the health modelling of transport, a lot of the work's occurred in silos, while the microsimulation models are highly suited to incorporate health behaviours, exposures and outcomes, and environmental factors that influence them. And in Jive and Glass, we started this integration and representing this person-centric approach, but there's a lot more to be do, and some of this is what we're doing in DARE, where we're using this to think about resilience of transport infrastructures and how this interacts. We can test that in this sophisticated agent-based environment. Thank you.
Thanks for that, James. Much appreciated, and thanks for battling through that cold. It sounded like you were really struggling at some points. Yeah, one thing I made a note of there is I can see how both the Sustrans index and the PCT could be used to really complement each other. Obviously, the index at a higher level, and then the PCT at a more localized level. You did really well at answering all the questions I had for you later points. I can see there's a few on the e-bike scenario in the chat there. So Stephen says, are the e-bike health benefits, are they balanced out by the time you consider that typically people will use their e-bikes more and travel further? I assume that'll be the output areas that they're from anyway are probably longer distances, so you'd get the bigger effect that way.
So, I mean, that's a kind of empirical question, and we try to represent that in the models, this kind of duality of the effects. And I think the overall health benefits are marginal at the population level, are marginally bigger under the e-bike scenario. The CO2 savings, of course, are a lot bigger. But for an individual, it's going to vary. And people who are doing short trips, well, you know, I mean, so it's going to vary for individuals, it's going to vary by areas, which at an average total level, probably the health benefits are bigger with the e-bikes because they just enable so much more cycling.
And then Jeff asks,
yeah, and the answer is yes.
Okay.
Yeah, I mean, it's relatively, I mean, crude, simple. I think we assume it kind of halves the effect of hilliness. And we had some evidence on this, but it was a bit limited. Obviously, it's going to depend a bit on the bike as well, the access that people have, and it'll depend on individual characteristics. But yeah, we do. Yes.
Okay. One thing I thought was we have the hilliness, we have the gradient and the distance traveled as factors, but is climate, could it be incorporated in some way? You know, with more rain in the northwest, perhaps, and it's colder up in the northeast.
It could, yeah, and I mean, I think, you know, I mean, John Parkin and others have done work on that previously. I mean, there is work out there, and it would be. I mean, I don't think the effects will be that big within, you know, say an England and Wales context. And you know, some of these things, obviously, people do get used to. I mean, and people may have seen, you know, pictures from Finland of where people were quite willing to cycle at -10, which I think most people in England would balk at. And it depends on, you know, whether they clear ice and so on, and protection of cycling infrastructure. But yeah, it would be possible to include something. I mean, of course, what we want to do in there is look at more extreme events around flooding and heat and see how these, you know, when it gets, will impact on behaviours and disruptions.
You mentioned that this updating to the 2021 census data would be very difficult. But then I think you alluded to the fact that it might not be that useful anyway, because I'm assuming because of it was in the middle of the pandemic.
Yeah, I mean, you know, obviously it would be possible to do it. I mean, obviously it would need funding but I think we do have concerns about how useful the 2021 data would be. I mean, I think it would give some useful information, but clearly, you know, and clearly working from home, and I think some probably furlough and stuff was still quite happening quite a lot there. I mean, I do think with the new approach that I showed from the Jibe and Glass projects, it will be possible to build a full behavioral model and then build interfaces on top of that. That instead of using, essentially the PCT uses data basically from the census, and okay, we create a synthetic population using the data, so it's not quite the real data, but it's pretty close. But with the behavioral model, you have far more flexibility. You can cover all trip purposes, and you can have changes to cycling and changes to, you know, land use and so on and so forth. So I think in the future, what I would imagine we'd want to do is build these behavioral models and then build interfaces on top and different ways that people can interact with them, as well as people with more coding, you know, interact with the actual underlying model itself. well, a little bit more work is needed before
Yeah.
we've got that yet.
I've got one last question. It doesn't look like we've got any more in the chat there, but it was on the topic of COVID, and it's a propensity to cycle tool. Did you see some of that propensity being realized during the just sort of maybe even anecdotally, but the areas that you were indicating had a higher propensity to cycle? These are places, obviously trips were very different at the time, but did these areas see the biggest increases in cycling?
I don't know. We haven't done that analysis. I mean, I would say actually on the earlier question, I mean, when you look at Cambridge, while Cambridge stands out very much in terms of the high cycling levels, and they're far more than you would expect from the model, the model does actually say Cambridge does have the highest cycling potential. So at least part of the difference between Cambridge, if only a small part, and other areas is explained by the kind of the flatness and the kind of trips people are making and so on. But we haven't done that analysis of change. Obviously, it also depends what policies appeared in different places, and some places put in some great policies during COVID, and other places less so.
Yeah. Okay, excellent. I think we'll leave it there. So once again, thank you to both our presenters today. If there's no more questions, I'll close this webinar.